You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. I'm really excited to introduce our guest today. We have Rakesh Tondon. Rakesh is a serial entrepreneur and currently the co-founder and CEO of Dr. Treat, a pet health and wellness company powered by technology and driven by data. Previously, Rakesh was a co-founder and CEO of Leto, a fashion e-commerce company focused on rentals of women's apparel and accessories. Prior to Leto, Rakesh spent 12 years in technology investment banking, starting his career at JP Morgan Technology Group in New York, and later moved to San Francisco to join a boutique investment bank. Rakesh holds a bachelor degree in economics and management from Wittenberg University. Rakesh, welcome to the show. Thank you for finding the time.
Thanks for having me. I appreciate it.
So, lots of companies are building the combination now of vet care and technology. Why don't you tell us what the Dr. Treat is about and what you're trying to create?
Yeah, really, at Dr. Treat, what we're trying to do is reimagine pet health and wellness, starting with veterinary care. So, the idea to start Dr. Treat honestly was inspired by our dog Coco, which is when we realized how backward veterinary medicine was. And we saw all of the shortcomings in the space, really looking at customer experience, the quality of care, the consistency of care, and the overall pre and post appointment experience. And we just felt like it was so far removed from what human medicine was. So truly decided to build Dr. Treat to help pets like Coco get access to quality and better healthcare and to provide pet parents like ourselves a better experience. So in a nutshell, how we're different or what we're trying to really do here is offer highly personalized and preventive in-clinic and virtual care for pets. So today we're focused on cats and dogs only.
So walk me through it, because your pitch is very generous about providing better pet care and everything else, but it could be very generic. So for listeners that can't picture it, can you walk us through how is the pet owner experience or Coco's experience is different from any other vet hospital?
Yeah, so Dr. Treat, the way we're different is a big focus is on providing preventive care that is highly personalized to your pet's unique needs. So we believe every pet is different and every pet is unique. And so we're going down to not just understand, okay, if it's a 6-month-old Labradoodle that has certain issues, we're actually going down to the genetic level to understand what the genetic makeup is. We're then looking at all of their medical history and then coming up with a very personalized plan based on the genetic makeup, based on their lifestyle, their diet, and their surroundings, and the pet parents' lifestyles to come up with ways to keep this pet happy and healthy. So, in some ways, we're looking at it from a very deep perspective, and we're using technology to guide us to making better decisions for the treatment options that we give for any pet that comes to Dr. Treat. And in a lot of ways, what this helps us do is take that sort of proactive approach to keeping that animal healthy and keep them out of clinic. So we truly want to be the company that says, we'll give you the tools, technology, infrastructure, and support to keep your animal healthy and out of the clinics versus just treating them when they come in. And truly, when they do come in, we'll give you the best possible experience and make sure we provide a consistent experience to that pet, no matter you see doctor number 1 or doctor number 4.
It sounds like a premium offering. Would that be fair?
So it is a premium experience at a very accessible price point. So we've got a subscription. So it's $149 a year. The $149 is essentially your way to get unlimited care for your pet. You can come into the clinic when the clinic is open, when the clinic is closed. You have access to our virtual care platform where you can speak to a person over the phone or over video 24 hours a day, 7 days a week. So, really giving you access on your fingertips on your app.
Yeah, sounds very fascinating. I remember, when I first heard about Dr. Treat, and remember the contrast of the branding. And I think what you guys are trying to do reminds me of Modern Animal. So if you were to compare and contrast Dr. Treat against Modern Animal, another California-based animal startup it says a lot of the same things. That, like, back to Ivan's point, is it really the preventative care that differentiates you guys?
Yeah, look, I think we all look very similar. We're taking a very technology first approach to providing a better experience. And I think that's where the commonality sort of ends. We're taking a very comprehensive approach to preventive care, and offering that highly personalized preventive care is really what differentiates us from any other vet clinic that's out there. Going down, so what we do is when clients join, we try to understand not just the very basic details of the pet, but also we collect the genetic data, and taking that genetic data, overlaying that information on top of all of the other information around the vitals of the animal, the lifestyle, the diet, and several other data points, we then come up with that unique plan to keep your animal healthy. And so that is our secret to offering better quality care compared to anyone else.
No, that's really cool, and you know what, this is what's happening. This new generation. It's not. I would say that yes, maybe Modern Animal pioneered it, but I think this is a new generation of basically platforms that there's 32,000 vet clinics, and I think eventually in the next 20 years every single hospital will have to offer it. You have partial virtual care, you have on-site virtual care. The interesting thing that you're emphasizing so much that you're focusing on preventative care. So almost your success is when pets never have to go to your hospitals because they're all preventative care.
That's exactly right. I mean, the reason we got into this business is because we said, we want to be that company that keeps animals healthy. Because no matter how beautiful the clinics are, how slick your mobile app is, going to a vet or going to a hospital is never a fun experience. So we truly want to be that company that says, let's give these guys the best possible care and the pet parents the best possible information to keep them healthy and out of the clinics.
No, that's awesome. No, I truly think that this is like I keep talking about this as basically this is a moment for vet industry, like a moment for Uber, for taxi, Airbnb, for hotels. It's like this is a new platform. How does that work with the app? So let's say I have Coco and I have a concern. Do I text? Do I call right away? Do I engage with a teletriage service first, or do I engage with a veterinarian right away? How does that work?
You can do it in whichever way you want. So we want to give you access, and then membership gives you unlimited access. So you can get them access via phone, video, or you can go into the clinics and meet with the vets. We typically don't try to communicate via text because we just can't get enough information. So we try to do it as efficiently as possible. And if it's an emergency, we try to do our best to triage that situation as best we can remotely. If we can't, then we bring them in. If it's after clinic hours, we handhold our customers, give them that concierge type experience to refer them to another facility that may be better suited for that emergency care.
Rakesh, it's so interesting. I look at your resume; it's an impressive one, and you gave us the origin story of the business, but I still don't know that I'm like really bought in that. That's all there is to the origin story. What happened to make you want to be the CEO of a pet care company? Is it the opportunity? Is it really that you just wanted to provide a better experience? Give us a little bit more.
Yeah, so I think that's a fair question. So, we got Coco during the pandemic. That was when I was taking some time off after my previous startup, and very honestly, wasn't really looking to start another company. When we got Coco, and we went through three different vets, and trust me, we're not the high maintenance type of clients. We just felt that we got good care, but it was a very inconsistent experience every single time. We felt there were a ton of pain points that could have been addressed by some very basic things like taking an appointment, rescheduling an appointment, getting the medical records, passing on that information to the insurance company, or getting pre appointment information, post surgical care. And we just felt it was just very subpar compared to human health. So we changed vets. We got a mobile vet, and we had a very similar experience with that mobile vet as well. And then the third one was so bad that we went back to the first one. So we just honestly felt like either we'd been dealt a shitty card, or this is just how the industry was. And then when we talked to more pet parents like ourselves, they all had very similar stories. So we felt like, given the pandemic fueled adoption of pets, the market was ripe. It was a pain point that we understood very well. And with my sort of focus always on doing things more efficiently, I just felt like we could bring something interesting to this space for pet parents. And that's really how we got started. And then my wife, who is my co founder now, started spending a lot more time understanding how we could do things more efficiently. So one thing led to another. We convinced each other that this was the industry that we wanted to spend the rest of our lives, so that we could give pet parents like ourselves and pets like Coco a significantly better, happier life.
Okay, I'll take that as an answer. I got a two-part question coming to you now. So let's think out 5 years. What do you think Dr. Treat will become? And then, because we're focused on innovation, what's so innovative that you guys are doing?
Yeah, so I think there's a lot of things that we're doing. So we're not just looking at, us becoming a better veterinary company. We look at ourselves as a pet health company. And so we're starting with veterinary care today, providing that very preventive focus on care. But where we want to go is really become the Kaiser of animal health. And what I mean by that is really be that one single integrated provider of care and coverage in terms of insurance, and offer care to our clients. So that's sort of who we desire to be, who we want to become in 5, 10, 15 years. In terms of, what's so innovative and what we built, there's really a lot. And, I'll talk about brand last, but brand is going to be a really big piece of what we're building. So on the innovation side, on the consumer front, it's all about access and experience. So what we've done is really created a single native app for our consumers to interact with Dr. Treat, making it super simple for them to access the medical records, medical history, doctor's note, communication with the doctor or the care team. We've created a fully integrated telehealth and telemedicine platform for that sort of always on feature for immediate access. So whenever they need care, day or night, they have that access. We built out a smart scheduling system. So it's super efficient and easy for them to get or book an appointment, cancel or reschedule all via the app, not talk to a client. We've got full end-to-end pharmacy integration. So a big pain point that we had was, you know, we wanted to get medicines delivered and we couldn't. And so we said this was something that was a non-negotiable for us. So a pharmacy integration for home delivery of all medications through several different providers that we have, so that you have the choice of provider that you want to pick. And then seamless, frictionless, no payment system. On the clinical front, really it's all about efficiency, consistency, and better quality of care. So we're building our own PIM, which gives us the ability to offer better quality patient care. So any check-in and intake is done seamlessly with all of the records in one place. So it's creating an automated sort of consent form sort of delivery in a fully integrated way. Communications with patients are done directly through the platform. Notifications and reminders are done directly through the app. On the medical exam front, all treatment plans are templatized. We've got full integrations with all the labs and diagnostic tools. So what we're trying to do is really give customers all of that information via the app. And so they may never have to even come into the clinic to talk to one of our doctors. They can do it all via the app. And and then on the administrative front, really building out employee scheduling platforms for better online scheduling for on our internal front, getting access to all of the pet's full medical records and billing and payment systems, which is all done in one single location. So, the innovation is not just on creating the best possible app, which is on the client facing front, but also on providing that sort of very consistent care that's based on data and research.
That's really awesome. That's really comprehensive. Thank you for kind of walking us through it. How do you find you're not from our industry? Sean and I kind of have our scars and scabs from trying to integrate with things and work with technology in our industry. How's your experience integrating I guess you need so the lab. Lab is probably a little easier, but with the pharmacy as well, was that a seamless experience, or were you surprised how it is? I like your laugh about this. And are
Uh,
there one provider better than other from technology point of view? We can bash anybody on this podcast; nobody will know, so you can be open about it.
well, let's just put it this way. If I had spent several years in the industry, I would likely not do this. So it took a little bit of naivete to kind of think we could solve all the problems and do things, integrate very seamlessly. Very honestly, like we did not find a lot of great technology companies in this space. And we saw this as an opportunity. So someone's problem was our opportunity. So we felt like we could build a modern system that integrates through APIs, which are going to be useful for us in the long run. We're using, and I'm going to actually bash Vet's First Choice, which, honestly is a very ironic name. It should actually be Vet's Last Choice.
I love that.
When our clients try to get medication through Vet's First Choice, it can take anywhere from 3 to 30 days.
Yep.
And when their promise is usually 3 to 4 days. We've had a ton of issues integrating with a lot of other platforms, but I think it's less of a platform issue, it's more of an architecture issue
Yeah.
because a lot of these systems were built so long ago that they were never built with APIs in mind. Or if they were built, they're such closed systems that they don't interact with other systems with much ease. So we're building out our own PIM. We're building all of the APIs with all of the systems that we want, relative to the retail industry, which is also fairly backward. The veterinary space is significantly further behind
Yeah.
than the other industry that I was in.
I know that Sean has a question, and we're kind of getting to the end of it. But it's funny because you said some of these systems weren't built for integrate. They weren't built. Some of these systems weren't built for internet. So-
No, they were built for DOS,
Yeah.
not NPI,
but just,
DOS.
but just one word. Who was the pharmacy you went with that was easy to integrate with?
So we're actually in conversations. So we're using Mixed Lab, which we absolutely love
Yeah.
because they're doing a phenomenal job. And then there's another one that we really like called Blue Rabbit.
Well, listen, Rakesh, it's been super awesome. We're out of time, so my question's going to have to wait for the next time you come on the show. But really lovely to hear what you guys are doing. It's very, very bold and pretty exciting. So we'll look forward to following your guys' progress. We like to wrap up every episode the same way. So is there a YouTube video, a book that you'd recommend to our listeners?
So a book that we actually had all of our teams read recently, or everyone in the company read recently, was called Unreasonable Hospitality by Will Guidara. He was the general manager of 11 Madison Park, which was the best restaurant in the world in 2017 or 2018. Great restaurant in New York, and really excellent book. Any sort of video. So I really like Simon Sinek. I think he's truly inspirational. He's very practical. So I watch a ton of his videos on Instagram and YouTube.
And the second question that we usually ask, is there a guest that you would suggest to be on this show?
We really like Dr. Patrick Mahaney. He is an incredible vet, and who I call the vet to the stars. So someone that I think practices medicine better than 99% of the vets out there, with a very holistic approach. Someone I think I've learned a ton from, and we use a lot of his learnings in the way we train our team at Dr. Tree.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.